This is Joshua Prasad. Oh, this child is vomiting blood, black. We in Mahdia Hospital since Monday. This child crying for belly pain, breathing problem, and we can't get a medivac to go to Georgetown up to now of this child. Tomorrow.
Distance is, well, it's rarely just about miles or kilometers, right?
Absolutely.
I mean, if you really think about it, distance is entirely about time. Like if I tell you a hospital is 50 miles away, that number is, well, it's practically meaningless until I give you the context of how you're traveling.
Yeah, because the map gives you the geography, but the infrastructure dictates your actual reality.
Exactly. 50 miles walking is a multi-day trek. But 50 miles in a sports car on an empty highway, that is under an hour.
Right, or think about a washed-out, unpaved road during a storm. That same 50 miles could trap you indefinitely.
Yeah.
But put yourself in a helicopter, and it just becomes a minor errand.
It's just a brief interruption in your day.
Yeah, exactly.
But when you're dealing with a severe medical emergency, that gap between what the map says and, what the reality on the ground dictates, it's not just a frustrating logistical delay.
No, not at all.
It's this terrifying window where lives are actually lost. The map might tell you salvation is close, but the failing infrastructure tells you it is entirely out of reach.
Which is exactly what we're looking at today.
Right. So welcome to today's deep dive. We are centering this entirely on that terrifying distortion of time and distance. For you listening, we're looking at a scenario where a theoretical 50-minute journey has inexplicably stretched into a grueling 2-day waiting game.
Yeah, and we're dissecting a single, highly urgent statement. It was published by a group identifying themselves as Team Muhammad.
Right.
And the text itself is it's remarkably brief. It's barely 150 words. You could literally read the entire thing aloud in less than a minute.
But do not let that low word count deceive you.
Oh, definitely not.
Our mission today is to unpack how this tiny 150-word plea regarding an acute, on-the-ground medical situation is strategically constructed. We want to see how it exposes what the authors allege are chronic systemic healthcare and political inequalities in Guyana.
It packs a massive punch in a very small space.
It really does. But before we pull the text apart, a really critical note for you listening.
Yeah.
This source material contains politically charged allegations.
Very charged.
Yeah, and they're directed specifically at the Guyanese government, naming Minister Frank Anthony directly. So, as we guide you through this, we are maintaining strict neutrality.
Right, we aren't taking sides here.
Exactly. We are not independently verifying the claims about the hospitals, the aircraft, or the politicians, and we are absolutely not endorsing the specific political viewpoint.
Yeah, we're really just operating as analysts of the rhetoric here.
Yes, looking at the architecture of the argument.
Exactly. Our focus is on how the author sequences information, how they juxtapose specific data points to generate an emotional response, and really what underlying mechanisms of the healthcare system they're attempting to expose.
So let's just get right into it. The statement, it drops us instantly into a micro-level crisis.
Yeah, there is no preamble whatsoever.
None. We're introduced to a child named Joshua, and he's currently stuck at Mahdia Hospital, and his situation requires an immediate medevac to Georgetown for urgent treatment.
And then the author delivers this hook, right? This child has been waiting for almost 2 days.
Almost 2 days. The author immediately weaponizes that concept of time we just discussed.
They really do. They don't just state the 48-hour wait in a vacuum.
Right, they give it context.
Exactly. They explicitly point out that Mahdia is merely a 50-minute journey from Georgetown. So the text actually demands that the reader hold those two numbers in their head simultaneously.
A 50-minute flight.
And a 48-hour delay.
Which is, that's less time than a standard daily commute for a lot of people.
Yeah.
You could listen to a single deep dive like this one in the time it should theoretically take to save this child. Yet the clock has ticked past 48 hours.
It's pretty staggering when you put it like that.
It is. And to make sure the reader understands exactly who is to blame for this delay, the author introduces a very specific contrast.
Right.
The text says, quote, "With all the investments and purchases of planes and helicopters for the state, yet this child is waiting to seek urgent care."
So they took these two isolated facts and essentially forced them into a collision. On one side, you have the state's capital investments, right? Shiny new planes, the high-profile helicopter purchases.
Right, the big ticket items.
Exactly. And then on the other side, You have a child deteriorating in a hospital bed.
It's a stark image.
Extremely. By putting them side by side, the author is diagnosing a massive, fatal bottleneck.
It actually makes me think of an analogy.
Okay, let's hear it.
Imagine a neighborhood, right, where a house catches on fire.
Mm-hmm.
And the city has just purchased this state-of-the-art fleet of bright red fire trucks. Those trucks are parked right outside the burning house. The chrome is gleaming, the engines are idling, but
But no one's pulling the hoses off the rack.
exactly, no one is turning on the water. The neighborhood is basically forced to watch the house burn while surrounded by the exact tools meant to save it.
That's a great way to put it.
So when the author points at the helicopters, they are actively changing the nature of the alleged failure.
Yeah, because if the author only talked about a child waiting for a flight, the average reader might just assume, the failure stems from a lack of resources.
Right, they might think, oh, the country simply doesn't have the aircraft to perform the medevac.
Precisely. But by explicitly reminding the public that the state does possess these expensive air assets, the author removes poverty as an excuse.
Wow. Ugh.
The failure completely transforms. It goes from an unavoidable tragedy of limited resources into an entirely avoidable tragedy of execution.
It paints a picture of a government that can buy the hardware, but is utterly incapable of running the software.
Exactly, because buying a helicopter is the easy part, right? You just sign a check.
Right, anyone with money can do that.
But launching a medevac, that requires a complex, synchronized human chain.
You need a dispatcher to take the call from Mahdia,
You need a mechanic to clear the aircraft,
a pilot ready on the tarmac,
an in-flight medical team with sterilized gear.
and a receiving doctor in Georgetown with an open bed.
Exactly. If one single link in that human chain snaps, the multi-million-dollar helicopter does not leave the ground.
And the author knows this, that mechanical reality is the bridge between the micro-crisis of little Joshua and the macro-crisis of the broader healthcare system.
Yeah, a 48-hour wait for a 50-minute flight points directly to a severe breakdown in the human infrastructure.
Which totally explains the sudden pivot in the text.
It's quite a shift, isn't it?
It really is. I mean, in the span of a single sentence, the source shifts gears entirely. We zoom out from the emotional weight of this one child's emergency, and suddenly we're looking at sweeping allegations about the working conditions of healthcare staff across the entire system.
Right. They name Minister Frank Anthony.
Yes, claiming he is failing, quote, our Guyanese brothers and sisters.
And then comes that rapid-fire list of systemic labor grievances.
Yeah, health workers aren't being paid on time. They're working grueling hours for minimal salaries. And a severe shortage of workers is putting an immense strain on the nurses.
The lens just widens dramatically. We go from a singular patient's pain to the collective exhaustion of the state's workforce.
But I have to play devil's advocate here for a second, just looking at the sheer speed of that pivot.
Go for it.
Because the emotional hook of a sick child is incredibly powerful, right?
Oh, absolutely.
So are the authors essentially using Joshua's critical medical emergency as a convenient Trojan horse?
I see what you're saying.
Yeah, like it reads almost like they're hijacking a visceral life or death moment simply to air systemic union-style grievances about paychecks and shifts.
Well, you could definitely read it that way if you view those two things as disconnected. But the text is actually arguing that the medical emergency and the labor dispute are the exact same crisis.
Okay, interesting.
The author is forcing the reader to understand cause and effect. You cannot untangle the delayed medevac from the allegedly unpaid workforce.
Right.
Joshua's situation is the visible symptom, but the labor conditions are the underlying disease.
That makes a lot of sense. I mean, for you listening, think about your own daily life or your own workplace. If you, your department, and the people you rely on haven't been paid on time, and half the staff has quit because of the strain...
The basic functions of your job start to fall apart.
Exactly. Now apply that to a hospital. The author is telling the public, you want to know why a 50-minute flight takes 2 days? Go look at the people holding the system together. They are collapsing under the weight of it.
Yeah, the text is meticulously portraying a top-down structural failure. By injecting Minister Frank Anthony and the labor conditions right after establishing the child's plight, the author traces a direct line of culpability.
From the top all the way to the bottom.
Exactly. The systemic rot allegedly begins at the ministerial level with poor compensation and understaffing. It travels down to the strained nurses trying to operate the system, and it ultimately manifests as an acute emergency for a child languishing in Mahdia.
Because the workers are the mechanism that makes the state's shiny helicopters fly. If the workers are broken, the machines are completely useless. So we have the victim, little Joshua, waiting desperately. We have the alleged mechanics of the failure, the strained and unpaid healthcare workers. But to fully galvanize a reader, a political text usually needs more than just victims and broken systems, right?
Oh, definitely. To spark genuine outrage rather than just, passive sympathy, the narrative requires a villain.
Yes. The author needs a stark foil to contrast against these everyday Guyanese who are suffering on the ground.
And the author delivers that foil by introducing a really jarring double standard. They shift the focus onto the political leadership to illustrate a profound disconnect between the ruling class and the citizens they govern.
The text claims that ministers travel freely around the country, even explicitly mentioning travel for entertainment purposes,
Yeah.
and they do it on the backs of the taxpayers.
It's a direct hit at the alleged frivolous use of state resources.
And the inclusion of the word entertainment is such a calculated rhetorical strike.
Oh, absolutely. It highlights mobility without purpose, juxtaposed directly against a child who desperately needs mobility for survival.
Wow, yeah. And then comes what is probably the most devastating claim in the entire 150 words.
The overseas care.
Yes. The source alleges that these very same ministers get their medical checkups overseas.
Yeah.
While a taxpayer's child is trapped in Mahdia for 48 hours just trying to get to the capital, the leadership is allegedly boarding international flights to entirely different countries for their routine medical care.
It's quite an accusation.
It really is. Let's go back to an analogy to understand how this lands with a local citizen. Imagine a restaurant owner who aggressively demands that all of their staff and all of the local townspeople dine exclusively at their establishment.
Okay.
But every single time the owner gets hungry, they sneak out the back door, get in their car, and eat at a premium luxury restaurant across town.
Right. It's an incredibly insulting dynamic to watch unfold.
It really is.
And your restaurant analogy actually highlights the psychological core of the author's final point. The claim about overseas medical care is the ultimate punchline in this narrative of inequality.
It moves the accusation way beyond mere incompetence.
Exactly. Because when a leader flies to another country for a routine checkup, they're making a tacit admission. They are broadcasting to the world that they do not trust the very hospitals they are responsible for funding and managing.
Right. If the local hospital isn't good enough for a minister's preventative checkup, it is certainly not equipped for a citizen's life or death emergency. The text is basically accusing the leadership of intense hypocrisy.
Yeah, the author sketches out a rigidly two-tiered society in just a handful of sentences.
It's really dense.
It is. The bottom tier is occupied by the taxpayers. Their labor and money fund the state's aircraft, they fund the minister's domestic entertainment travel, and when tragedy strikes, their children languish in under-resourced local hospitals.
And the top tier.
The top tier is occupied by the elite, who reap the benefits of those public funds to access premium functional healthcare across international borders.
The contrast in mobility is just staggering. The citizen is trapped by geography and a broken system. The politician transcends geography completely.
Perfectly said.
And the author wraps this entire web of accusations into one pointed rhetorical question: is this putting people first? And then they sign off by wishing little Joshua a speedy recovery from Team Muhammad.
Ending on, "is this putting people first?" is really a masterstroke of political framing.
How so?
Well, the author takes a generic, feel-good political slogan like the exact kind of phrase you see on campaign billboards and hear in election speeches, and holds it up to the harsh light of reality.
Oh, I see.
They place that slogan right next to the image of a child waiting 2 days for a 50-minute flight. The question essentially demands that the reader reconcile the political promise with the alleged on-the-ground catastrophe.
Right. When you actually slow down and pull the threads of a short text like this, the density of the argument is remarkable.
It really is.
It is just so easy to scroll past a 150-word post on your feed, register a fleeting moment of sadness for a sick kid and completely miss the architecture underneath.
Absolutely. I mean, we just unpacked 3 distinct, carefully constructed layers from this brief plea.
Yeah, let's recap that really quickly.
Sure. So we started with the acute crisis, the 48-hour wait for a 50-minute flight. And that exposed the stark gap between the government owning the hardware and actually possessing the operational reality to use it.
Right. And then we moved to the chronic strain. The text argued that the medevac bottleneck is a direct consequence of an underpaid, overworked, and severely short-staffed healthcare workforce.
Exactly. Linking the acute emergency at the bottom to systemic labor failures at the top.
And finally, we analyze the rhetoric of inequality. The text painted a really damning picture of political hypocrisy, claiming leaders use taxpayer funds for frivolous travel and overseas medical care while leaving the citizens trapped in a crumbling local system.
It's definitely a reminder to look closer at the information we consume every day. The sequence of words, the specific data points placed next to one another, the emotional pivots, they are all engineered to take the reader on a specific logical and emotional journey.
Yeah, the authors use the undeniable urgency of a single child to basically map out what they see as the systemic failure of an entire socio-political class.
The power of the text really lies in making the abstract failures of bureaucracy feel incredibly immediate and visceral.
It does. We have spent this deep dive analyzing a highly visible, high-stakes emergency. A child in a hospital bed needing an urgent medevac is just about the loudest alarm a healthcare system can sound.
Without a doubt.
But I want to leave you listening with a lingering thought that stems directly from the systemic implications we've just unpacked.
Oh.
If a healthcare system is allegedly strained to the absolute breaking point, to the degree where a high-priority, life-or-death, 50-minute transport takes 2 full days to execute,
Right.
how much invisible friction exists in the daily, non-urgent care for citizens living outside the capital?
Wow. Yeah, if the system cannot muster the resources and coordination to save a life in immediate peril, the baseline functions of healthcare must be paralyzed.
Exactly. Think about the quiet alarms, the routine blood tests, the prescription refills, the preventative screenings for people who don't have a helicopter waiting, much less a commercial flight out of the country.
Yeah, if the loudest alarms are muffled by bureaucracy and exhausted staff, the quiet ones are completely silent.
The map might show a hospital nearby, but as we have seen today, the physical distance means absolutely nothing when the systemic distance is vast. The reality on the ground can be a very dark story. Something for you to ponder long after this deep dive ends.